Hello, my name is Dr. Cameron Nixon. I am the Chief Transformation Officer for Southwell. I'm also a practicing primary care physician, and we're here today to really discuss the COVID vaccine. Why it's a choice, why I think and encourage you to get the vaccine, and what it's going to do for our community. In order to help you make a better decision on whether or not to get the vaccine, we actually have brought together a team of our Southwell physicians to actually answer questions, concerns that you may have about the vaccines, what it means, and some of the things you've already been hearing on the news.
At this point, we really don't know how long this vaccine will be efficacious, will protect you from coming down or contracting COVID-19. And so at some point, there may actually be a booster that's administered. I do know that both Moderna and Pfizer are working on boosters right now because there have been some mutations in the virus. And so those two companies are actually working on a booster that may be administered at some point. And so in that sense, it's very much like some of the other vaccines that we've had. It would be very different, though, than, for example, the measles vaccine, in which you have a series and then you're finished for life. Or the smallpox vaccine, as some people will remember, in which you receive that and you're finished with that vaccine for life. This will likely not be the case with the COVID-19 vaccines.
We currently have two vaccines available here. That's the Pfizer vaccine and the Moderna vaccine. Our testing sites are here in Tifton. We're testing at the TIF YMCA drive-thru, where you can be vaccinated there. You can also be vaccinated in our Southwell Medical in Cook County. We actually have a drive-thru vaccination on Wednesdays there. Here in Tifton, we're vaccinated Monday through Friday. And so if you want to get vaccinated, we encourage you to call the number 229-353-2200 to schedule your vaccination.
So with any vaccine, there's certainly going to probably be, in a certain percentage of people, some side effects. That's not an unusual situation for any vaccine or any medical therapy. With this vaccine series, either the Pfizer or the Moderna, the two options currently available and FDA approved, roughly a third of patients are going to experience some degree of symptoms. With the first vaccine, or the first dose of the vaccine, generally mild arm soreness, maybe some muscle tenderness in the area of the injection is quite common. In fact, with my shot, that's basically what I experienced. With the second shot, some people experience a little more what I'd call mild systemic symptoms, maybe some body aches, maybe some mild headache, fatigue. Generally, these last 1 to 2 days, and at best, I would consider these mild to moderate symptoms. Again, roughly a third of patients will experience that, and some patients, perhaps even the majority of patients, have no side effects or symptoms. There are, of course, some patients who are going to experience severe side effects, and when to seek health care expertise or opinion regarding what you might consider a serious life-threatening event is, to some degree, going to be up to the individual patient. If you ever feel like you're having a life-threatening emergency, certainly going to your nearest emergency department is going to be the best advice. With all vaccine administrations, you're monitored for a period of time after the injection, and most severe side effects would be experienced in that short duration of time where you're being monitored. So after you go home from your injection, most patients are going to be just fine.
Well, that's a very good question. For some people, the second shot is worse than the first. Some people experience headache, fever, myalgias with the first shot, and of course local arm pain is associated with the injections as well. Because the immune system is primed, so to speak, by the time the second shot is administered, there is an increased likelihood that you will have some symptoms related to the injection. However, that is a sign that your immune system is working, and so it's actually a good thing that you're having some of those type side effects. It's interesting that people who have had COVID-19 diagnosis within the last several months are more likely to have a higher immune reaction and symptoms related to the injection. You most definitely should get the vaccine even if you've had COVID-19 in the recent past.
So depending on the vaccine that you get, for the Pfizer vaccine, you should get the second dose 21 days after your first one. And with the Moderna, it's 28 days after your first one. And there's a little leeway, 4 days before and after is acceptable. To get the full immunity that was demonstrated in the studies, both vaccines are needed at this time.
If you've had COVID-19, and we want to encourage all people across the population spectrum to get COVID vaccination. But certainly if you've already had COVID, that question comes up quite a bit. While you're currently ill, not only with COVID or any other illness, you don't need to get the vaccination while you're ill. So you need to be healthy and otherwise, certainly without fever or other symptoms, during that vaccination course. We would encourage you to at least wait probably about 90 days after your symptoms with COVID-19. At minimum 2 weeks, but talk to your healthcare provider. They're going to be able to guide you specifically if there are individual circumstances regarding your overall health. But we are encouraging right now that patients wait somewhere between 2 weeks and 90 days before they receive the vaccine. COVID-19, as we all know, has been around roughly about a year now. We're still learning a lot about the disease process. Certainly the degree to which different people have immunity is still a work in progress in some way in our understanding of that. We are strongly encouraging all individuals, whether they've had COVID-19 or they've not had COVID-19, to receive the vaccination to ensure immunity. We're learning that immunity may wane, meaning decrease in some patients. Certainly some patients may have prolonged immunity, but we're learning more as we go along. So the answer is nothing's perfect. So every time you get any vaccine, there's varying degrees of protection. As vaccines go, the COVID-19 vaccines are quite protective. So roughly 94 to 95% protection is provided by these vaccines. If you compare that to the flu shot, depending on the year and the certain flu vaccine basically type you get, you're going to get roughly 50 to 60% protection from that. So as vaccines go, this is a very good and effective vaccine.
What the Moderna and Pfizer vaccines are doing is providing the mRNA, which will actually be the code to make the protein, the spike protein that sticks on the outside of the cell. With the sticking of the outside of the cell, your body will recognize this as being foreign and attack it, and then remember it. And so the next time we give you the second dose, the booster, it will actually allow you to recognize the M spike protein a lot earlier, and therefore fight off this virus very quickly once you see, or if you ever see, the real thing.
No, at this point, we can say that the vaccine does not cause infertility, but there are some people who are hesitant to get the vaccine, especially if they're of reproductive age, and I can understand that. So my message to them would be, you can wait, but as long as you physically and socially distance, wear your mask at all times, especially when you're outside, and avoid gathering with those people who are or who don't live in the same household as you are, then you should be protected. We definitely recommend that pregnant women receive the vaccine, especially if they're high risk or in the high risk category. For example, if they're healthcare workers or they're frontliners, The reason is studies have shown that pregnant women are at high risk for COVID complications and severity. If they get COVID infection, their risk basically of going into the ICU, being intubated, or dying from COVID-19 is much higher compared to non-pregnant women in the population. Also, COVID-19 infection in pregnant women can lead to birth loss or preterm birth loss, basically. So that's why we would definitely recommend the COVID-19 vaccine for pregnant women.
I did a lot of reading journal articles about the vaccine. I also talked with people who do vaccine research themselves, because I'm a family doctor, but I am not an expert on vaccines. I know a lot about them and I know how they work, but I'm certainly not the expert. So I talked to those people. I also talked to my really good friends from medical school who are OBGYN doctors and pediatricians. All of them were able to reassure me that this vaccine is safe in breastfeeding. Because of the way the vaccine works, there's very few ingredients in it, and it's a very safe vaccine.
If you have had a history of anaphylaxis to another medication, and then your body is more likely to have anaphylaxis to something else, and so that certainly puts you at higher risk when you take the vaccine. However, just because you have had other types of reactions to medications that are not anaphylaxis, that doesn't necessarily mean that you will have anaphylaxis to this or even a reaction to this vaccine, so we would still recommend that you take it. These two vaccines are incredibly similar. They both have about a 95% success rate in preventing the people that's been studied from contracting COVID-19. There are some subtle differences between the two. For example, the two vaccines are able to be stored, they have to be stored at very, very cold temperatures. The Moderna vaccine, not quite as cold as the Pfizer vaccine. That has nothing to do really with which vaccine you choose, but it may have something to do with which vaccine is available for you to take, depending on the facility storage capabilities. The Moderna vaccine actually is administered the first dose on day 1, the second on somewhere around day 28. The Pfizer vaccine is day 1 and around day 21, and there's a little bit of play in when you have to go back for the second vaccine. The Moderna vaccine also is a higher dose. There's a higher dose of the mRNA, so to speak, in that vaccine. But interestingly, the efficacy is similar between the two. So I've actually heard that there might be some decrease in the Moderna vaccine dose at some point. But probably the major difference between the two that might cause someone to get one vaccine over the other would be the incidence of anaphylaxis between the two. So about 2 to 3 people per million will have an allergic reaction or anaphylaxis to the Moderna vaccine, whereas about 6 to 7 per million people, per million doses, will have an anaphylactic reaction. So there's and that's really a small difference, but there is a little bit of a difference between the two as to which one is more likely to cause anaphylaxis. But my recommendation would be for, unless you've had anaphylaxis, to not worry about that and just take whichever vaccine is available to you.
So herd immunity is a way to control spread of a disease by a percentage of or a threshold of the population that is immune from the disease, either through vaccination or through actively getting the disease and recovering from it. That percentage, that threshold, depends on how contagious a disease is. The more contagious a disease is, the higher the percentage of the population is needed to achieve that threshold for immunity. For instance, measles is a very contagious disease, and you need about 95% herd immunity to achieve that control. With COVID, it's assumed that one patient with COVID can spread it to up to 1 to 7 other people. And so it's kind of difficult to say what exactly that percentage we need, but it is estimated to be between 70 and 90%.
The answer is yes. We still have to practice social distancing, wearing a mask, because the vaccine itself helps protect us from actually getting serious COVID and dying from COVID-19. But it doesn't prevent us at this point from actually being able to still be a reservoir and spread that virus to other people who have not been vaccinated.
No, it does not affect your DNA. There is actually a scientific reasoning behind why it won't affect your DNA. When the messenger RNA enters your cell, it never enters what's called the brain of the cell, or the nucleus, which is where your DNA is stored. It is only outside of the nucleus inside your cell where all of the building blocks for proteins are located. And so those building blocks for the proteins just make the spike protein without it ever entering your nucleus, which is where your DNA is housed. So it won't affect your DNA at all.
So what we'll ask you to do if you're one of the people who are eligible for a vaccination is that we ask you that you call our hotline at 229-353-2200 or check our Southwell website out where you can actually request an appointment. If you're able to use the website, you can download the paperwork that you'll need to fill out at the time of registration. When we call you back to schedule an appointment, we ask that you present a few minutes early in order to fill your paperwork out or to get you registered and check your temperature at that time. After you actually pass our registration point, a medical provider will review your paperwork prior to you getting your vaccination. At the point of you getting your vaccination, we will move you to a holding area where we reserve you for 15 to 30 minutes looking for any of those side effects we talked about earlier, such as anaphylaxis, shortness of breath, feeling itchy or flushing. And at that point, we will provide a date and time for your next appointment. And that will be it. Thank you for joining us today. As a reminder, if you're interested in getting a vaccine, please call 229-353-2200 here or check the Georgia Public Health website to schedule a vaccine in your local area. Thank you.